What are the links between general health and oral health? Well, we've been talking diabetes with Ira Lamster to find out.
Now, the number of oral complications of diabetes mellitus, however, is very large. The list is very, very long. In fact, there's no systemic disease that I'm aware of that has more different types of oral complications than does diabetes mellitus. In fact, HIV infection, as we know, before the era of highly active antiretroviral therapy, had a number of manifestations, but not comparable to this list.
Well, there are actually many oral manifestations of diabetes mellitus. The most important one, and probably the one that's known best by most dental practitioners, is gum disease or periodontal disease. And that's actually a two-way relationship. We know that diabetes makes the periodontitis worse, but there's good evidence to suggest that if you have periodontitis and you have diabetes, that will actually cause the diabetes to be in poor metabolic control. We know that diabetes mellitus is a chronic disease, and it occurs over decades, and a patient has to be faced with managing their diabetes over that period of time. So dentists can do a few things. Certainly they can make sure that the mouth is healthy. Because an unhealthy mouth, whether it's periodontitis or dental caries or candida fungal infections, can adversely affect quality of life. You will not eat a proper diet, and all of those things are very important for the patient with diabetes mellitus. But the astute dental provider, dental practitioner, can actually identify changes in the mouth that occur that the patient may not be aware of, or the patient's physician may not be aware of, indicating either undiagnosed dysglycemia, undiagnosed diabetes or prediabetes, or diabetes that's been diagnosed but not well managed. Oral healthcare providers need to embrace the concept that they could be active participants in the care of these patients. It even can go so far as to perhaps testing for HbA1c, glycosylated hemoglobin, or fasting plasma glucose in the dental office if a number of things are seen that indicate the patient may be at risk. Physicians don't talk to patients about the need to see an oral health care provider. They'll say you need to see the ophthalmologist, you'll need to see the podiatrist to make sure you don't have any foot ulcers, but they don't talk about oral health quite as much. Patients do not seem to be fully aware, because generally they would be informed by their physician, by their medical provider. And if that information is not being transmitted, then they're not going to know how to react. One of the things that meetings like this really promote is the fact that the mouth is connected to the rest of the body, and that we need to be aware, physicians need to be aware, dentists need to be aware, pharmacists need to be aware, nurses need to be aware of how these interrelationships really can affect both quality of life as well as the progression of disease.